3, 4, and 5. Okay. Remember? As Christians, we are specifically called by God to help those that are in need. It is, love your neighbor is the second most important commandment in the Bible. Now, we are called to help, whether it be because they are poor, whether they're sick, or maybe they're just having a bad day. But in many cases, your help can be the difference between life and death. Which is why I'm going to be teaching you guys how to perform the Heimlich maneuver. It is one of the simplest medical procedures that you can learn, and you are not required to be certified, CPR certified or lifeguard certified in order to perform it. I am lifeguard and CPR certified, so I am qualified to teach you all about it. I will teach you the 3 different procedures that you will use on an adult or child under the age of, or over the age of 1, an infant, or on yourself. The first and most common procedure of the Heimlich maneuver is on another person of just about any age except under the age of 1. You stand directly behind the victim. You're going to wrap your arms around it. You're going to take your prominent hand, whether right hand for me. You're going to stick your thumb out just a little bit, but put it in a fist. You're going to put it right below the diaphragm, which is just below the rib cage in the center of the chest. You're going to take your left hand, you're going to cover it to put additional pressure, and you're going to thrust upward and inward multiple times until the obstruction is dislodged, or the object in the throat comes out. This is the most common form. The next most common form is on yourself, and to perform it on yourself, it's basically the same process. You're going to stand up straight if you can. You're going to put, again, your hand with your thumb right here in the center of your chest. You're going to cover it, and you're going to thrust upward and inwardly. However, if you find it might be easier, you can also come to the surface of a chair or a desk. You push your diaphragm against the surface of the area of the desk. The third is on an infant, and this is a different procedure that you're going to perform because the infants are so much smaller than normal people. I have a quick video that demonstrates it a little more accurately with a dummy since I don't have one.
See if the infant can breathe. Give up to 5 back slaps. Give up to 5 chest thrusts. If the infant cannot breathe, repeat.
Okay, like they were showing, you're going to place the infant on your forearm, and you will repeat switching it back and forth. There is some debate over whether back slaps should be used because it has been proven to be a little bit harmful. However, it has been proven multiple times over and over again to be the most effective way. Also, if you noticed in the video, they used fingers to push into the diaphragm instead of the entire fist. So that way you don't damage the lungs or the rib cage of the infant. Also, some concluding points. You must always call 911 if at any time the victim goes unconscious. You call 911, and if you are not certified to give CPR, then step back. You're just going to have to wait, because if you attempt to perform CPR on an infant or a child or anybody and it goes wrong, then you may actually face lawsuits and all that. So also you need to remember to be forceful. You need to use pressure, and because if you don't, then you're not going to be effective and you might cause the person to go unconscious. So you need to be forceful and firm about it, because though you may damage some ribs or whatever, it would be easy. As long as you save their life, they'll deal with it. Not wrong. So, in conclusion, when you learn the 3 procedures of the Heimlich maneuver on an adult or child, an infant, or on yourself, you dramatically increase the risk of saving a person's life and allowing them to perform Christ's purpose for them.